Hi, Dr. Eric Barker here at Pete Plastic Surgery Center. So the question that we get the most often here about liposuction is what is the difference between VASER liposuction and all other modalities or traditional liposuction? This is a wonderful question because it happens to be the most critical question when we're talking about body contouring with liposuction. When you think about liposuction, I like to tell all of my patients, imagine the analogy of grapes on a vine. The grapes are the fat cell. The vine is kind of the framework that holds everything together under your skin. That framework that's under your skin that we're calling the vine is the support structure for your skin. It needs to be intact. It needs to be very, very well distributed so that the skin doesn't indent after liposuction. So when we talk about VASER liposuction, what VASER is actually a high frequency ultrasonic pulsation modality. Going back to the analogy of the grapes on the vine, instead of just ripping the grapes off the vine mechanically through liposuction, we're going to be treating the area first with the VASER probe. What that does is it vibrates very high intensity wise with that high frequency ultrasonic pulsations, and it heats the area. So what it's going to do is gently take all of that fat or those grapes off of the surrounding structures or the vine. What that does is it allows for that vine to remain intact while taking off all of the fat that is associated with it. The third thing that it does on top of that is it tightens the skin over the top. This happens before we take out any fat. So when we're talking about VASER versus traditional liposuction, this is where the big difference lies. VASER will pre-treat the area to ensure that when I'm taking the fat out through liposuction, we're not going to be left with a lot of contour irregularities or dimpling of the skin or issues with peaks and valleys throughout the operative area. So after we treat the area with VASER, then we do the power-assisted liposuction. Then I can be much more aggressive because I know the framework under the skin is going to be intact. Again, when you think about just tearing grapes off a vine, you never get clean removal of grapes. You're always going to be breaking that vine apart, sometimes even in half. Well, if you think about that with the skin being supported by that vine or that framework, it can never just support nice and smooth. It will always end up being dimple looking. So again, what is the main difference between VASER liposuction and traditional liposuction? It is the preparation of the area so that when I do remove that fat through a cannula, which is liposuction, I'm doing it in a controlled manner, much less traumatic and much more drastic results. Again, when we think about traditional liposuction, what does that mean? That means laser-assisted liposuction, smart lipo, tickle lipo, air lipo, power-assisted lipo, smart lipo, just traditional straightforward lipo. All of these modalities have the same issue where they don't treat the area prior to taking the fat out with liposuction. They also don't provide any skin tightening. What are we expecting for results in terms of the difference between VASER liposuction and traditional liposuction? With traditional liposuction, you have to expect to have irregularities. This is why when you get traditional liposuction, they will always recommend and say you need lymphatic drainage afterwards because they're manually manipulating the skin to sit where you want it to heal. VASER liposuction, you don't have to worry about that because the structure under the skin is still intact. It is going to heal in the correct position without those irregularities. Now, lymphatic drainage is still a wonderful option afterwards, but it's not 100% mandated. Okay, we know that the results are going to be of a higher quality with VASER lipo versus traditional lipo. What is the revision rate with both? If you look at the country, the national average of a revision rate with liposuction is up to 35%. That is nationwide. 1 in 3 people will need to have it redone because they don't like how it looks, it did not heal the correct manner, or you have significant irregularities. In my practice, we have less than 2% revision rate, but that is not because I don't do revisions. We have such a low revision rate because I use VASER lipo, which is of paramount importance, but I also do it awake in my clinic where I get to stand you up at the end of the case to look and see how gravity is affecting all areas. I make my high definition markings at the conclusion of that, lay you back down, and revise all the areas in the same setting. So again, what is the difference between traditional liposuction and VASER liposuction? Traditional liposuction is more traumatic, higher risk for needing for revision or poor outcomes, longer recovery time, Also, you cannot expect to look as smooth as you would expect to with VASER. Less issues with recovery time. It's typically cut in half. Less discomfort with recovery, less chances of complication, and a much higher chance to get the overall look you're hoping for with liposuction and body contour. If anybody has any questions about what is the difference between regular liposuction and VASER liposuction, this is something I'm very passionate about. I will be happy to sit down and chat with you. We can do a phone call, we can do a consultation. Any other questions that I can help you answer, do not hesitate and reach out.